Good afternoon, good morning, good evening, depending on where you are. So welcome to this Family Planning SRH Scientific Panel Monthly Seminar. This is a panel, UAPS panel, which is chaired by Professor Akani Akieni, and the vice chair is Dr. Estelle Sidze. So our seminar today, we are very honored to have Dr. Chilanga Asmani to talk about the integration of family planning into reproductive, maternal, child health and nutrition. Dr. Asman is a public health specialist with training in medicine and medical anthropology. He has more than 20 years of experience working at national and international organizations on sexual, reproductive health and rights programs in many countries in Africa, such as Tanzania, Kenya, Burkina Faso, and now he's currently working for United Nations Population Fund Regional Office for West and Central Africa as a regional family planning program and policy advisor in Senegal. So throughout his career, he has worked on providing technical, programmatic, and strategic support and advice on SRHR programs, and is currently the vice chair of the steering committee of the Community of Practice on Postpartum Family Planning Integration into Reproductive and Maternal Child Health and Nutrition Services in Francophone West Africa. So he will be sharing his experience on integrated family planning program on behalf of the community of practice. So Dr. Akani, so make sure you post your comments on the question asking section as he speaks. So, and later on, you will be able to take some comments and address those comments. So please, Dr. Asman, the floor is yours.
Thank you very much, Professor. Thank you for the introduction. I do hope you can all hear me. So as shared, briefly, I hope you can see me before I put up, continue with the slides. I'll really share some program experience that we have within the community of practice in this integrated approach. And I hope that from this experience sharing and from colleagues who are participating in this webinar today, we can get, additional insight, we can get some questions, but also from the different experience that you all have, we can also look at where we are now, what other advice, what other experiences, and what other, ideas can we have to really scale up this approach, which we'll see in the next few slides, really supports us in attaining our different reproductive health goals, but overall, of course, contributing to the reduction of maternal mortality and infant and child mortality. So I'll therefore share some experiences on behalf of the community of practice, which works on integrating family planning into MNCH and nutrition in Francophone West Africa. And as you see in the introductory slide, those are the 9 countries that are concerned, and a part of this committee of practice. And we really thank the ministries of health of these countries and key national partners, and of course, the donors supporting the work that we do. Next slide, please. A little bit of outline on what I propose to share in these few minutes so that we can look at this experience and get contributions from the floor on how more we can do and what better we can do. Thank you. Next. So when you look at the situation and the context, from different sources, when we just group the Francophone West African countries, we do see we are working in an area where the maternal deaths remain high. The number of children who do not survive the first 28 days of life is also high, as we can see. We also have quite a high the proportion of women who actually have their needs for family planning satisfied, as we see, needs still to, we need still to work to be done. And we also find that there continues to be quite a large unmet need, up to 1 out of 2 in the postpartum period. So immediately after birth, we also see that need is also not yet satisfied. When we look at the challenges when like malnutrition, it continues to be high, and of course related to that, the stunting rates are also high within this group of countries. Next. So having said that, we saw a combination of indicators that need to be improved in terms of access, utilization, with meeting the needs in terms of family planning and contraception. We saw more work that needs to be done in terms of maternal, newborn, and child health, but also nutrition. So from that perspective, we see that, when you look at women who come from underserved areas, far from different health facilities or access to healthcare, reaching a facility can be something which is time consuming, but it can also be quite expensive. In that regard, if we're able to use every facility contact as much as possible to cover all the needs of these women, and of course, and the children that come with them, it could actually be beneficial to try and work on some of those challenging indicators that we've seen. Though progress is there, but we still see challenges. So we're talking about, can integration help us to avoid missed opportunities when we have the client in front of us? We also looking at it in terms of valuable and cost-effective approach as we work within the health sector to advance universal health coverage, and of course, to meet the goals and improving in terms of strategies for primary health care. So these are some of what we think are the value added of this integrated approach. Next. So when you talk about missed opportunities and how can we, work towards, not missing these opportunities, or really looking at them as opportunities to provide care, we see, as we know, there are different modules. It can be a one-stop shop where all of the services are co-located, or it could be also through referral. But here we see from the level of the community, there's an opportunity to provide integrated services when the community health services are being provided, when we're having home visits, even when we're mobilizing or having outreach services as a delivery approach, there's a possibility for integration. When you look at the different services like antenatal care, during delivery, postnatal care, and also the care of the infant, we actually see an opportunity again here to meet the needs of the woman who's coming to services, and also the woman and the child. So when you look at this, these are all opportunities that we should be thinking of to reduce some of these missed opportunities we are actually talking about. So in that regard, given the context that we saw, given some of the indicators that were described in the beginning, a community of practice was established in 2020, and members of this community of practice include the Minister of Health, of course, leading the work in the respective countries. We have professional associations, of medical care providers like obstetrics, gynecologists, midwives, and other health professionals, civil societies, local governments, and the TFP here, we mean technical and financial partners. So all of these, thought about setting up a community of practice to look at how can these approaches be introduced, scaled up, and obviously advocated for as an important approach to address the challenges we have to advancing maternal, newborn, and child health. As stated in the beginning, the Francophone West African countries we're talking about are the ones mentioned there, and continue to thank the leadership in these countries to support this process. And towards working in this community of practice, one of the elements that was also found to be important is bringing a group of partners who support the work in these countries to actually group ourselves together so that the work in this area maybe could be better harmonized. We could share we could see where one partner is supporting, where should the other partner support, where could collaborations be sought, how could it be more harmonized, how could it be more complementarity, so that we're actually able to get the best in terms of how we work with partners in country. So a steering committee was set up, so far consisting of WHO Africa Regional Office, the West Africa Health Organization, the Society of African Society of Obs and Gynecology, SAGO, FP 2030, JPIGO, the UNFPA Office for West and Central Africa region, the USAID West Africa Office, and also the non-government organization IntraHealth through the Inspire, initiative, which is really focused on this integrated approach. And the goal is really to see how can we accelerate progress in this integration, but also, as I mentioned, can it help to provide a coordinated space, share experience, evidence, mobilize resource, and the like. So it's set up by having a steering committee, as I mentioned, currently chaired by the West Africa Health Organization. Members of the steering committee, as we see, we obviously have members of the committee of practice, as mentioned, from government and non-government organizations within the respective countries. And we've also developed a regional integrated platform. This is online, where we can share tools from the different countries, recently developed and launched e-learning. We conduct, webinars, and also through this practice, even regional events to really support, share evidence, and also for advocacy. So at country level, we have, the focal points, who are leading technical working groups for integration, led by the Minister of Health in their respective countries. So with a very close interaction with the steering committee to really lead the process, and of course, working with a big range and big group of stakeholders. So as we go, looking at some of these years of experience, we're looking at what kind of progress. So we've seen some level of trying to improve or ensure effective implementation. This is really having the country ownership, as I mentioned, with technical working groups led by government in their respective countries, bringing the partners together. The ownership is, as I mentioned, having country focal points from the ministries, supporting the work of the technical working group, and even trying to work, still a work in progress, to come up with the costed action plans. That's what we say, CAP, because they will see a number of initiatives, maybe at a lower level or at a pilot stage, looking at how it works, but how can we cost so that this could be actually systematized within the country as part of the overall programs being implemented in the country. There's also a number of important aspects that need to be taken into account. How is this approach institutionalized? So if we want to measure progress, if we want to see how we're going, is this work part of the indicators used to monitor the health sector in the respective countries? Is it part of the DHIS2 indicators, for example? The data collection tools that are usually used in country, would we have enough data for that can also look at how are we in terms of status of the integration? Looking also not only at national level, but what about subnationally? And then, of course, at the regional level, the community of practice really tries to bring together these different country experiences, country partnerships, to continuously working on advocacy, strengthen coordination, and try to see how do we catalyze and support country efforts. So we've seen some progress in this regards. Also, in the different countries that I mentioned that are working towards strengthening this approach through the Inspire project, which I'd like to, to mention here, there's a lot of work that has been done to see how can we move, move the chart, move the bar in the different countries in different stages, from actually just starting to at the level of advocating, building interest, establishing working groups on this integrated approach, going towards the end where you really have working groups in country trying to mobilize resources, working towards scaling up implementation of this integrated approach, not just at specific levels, but also can it be something that is more or less nationwide. So obviously getting to the last stage, we're not there yet, but that is the eventual aim, to see if this approach could actually be, as I said, institutionalized scaled up and implemented to scale. And this is where we have some of the progress in the different countries currently are at. So allow me to take just a few examples from one of the projects being implemented. One of the partners who's part of the steering committee agreed to share some of the project results, which we want to see. Can this be scaled up? Can we see how to really implement this to a bigger scale? And we're seeing in the different sites where efforts are being put to strengthen this integration of postpartum family planning into RMNCH and nutritional services, we're seeing over the years from 2018 to 2022, progress, for example, in terms of 48-hour postpartum family adoption is increasing, whether we're looking at delivery, is it immediate postpartum family planning, also looking at the overall acceptance. So we see a positive trends in that area, the postpartum. We're also looking in terms of what about adoption of these family planning methods during immunization or when the mother is taking the child to the healthy and newborn growth monitoring clinics as another entry point to meet the mother and child. And here also we do see positive in terms of progress being made to use this as an entry point for access to family planning. Also in terms now looking also what about the overall follow-up visits for newborns, infants. This is examples from Burkina Faso, Cote d'Ivoire, and Niger in these sites. So overall, just to strengthen, the attendance to the healthy growth for follow-up clinics for newborns, there's a general upward trend. If you see, the general graph, there could have been a bit of a down when we see during the times of COVID, and we do understand some of the challenges that led to some disruption of services, but there was also a pickup. So we're also looking at services now for the newborn in these demonstration sites have also shown some positive trends. If we look at the different entry points for postpartum family planning, these are just some figures also. Again, the number of total uptake between 2019 and 2022, we also see positive progress. And this is also, some of the results that we're seeing, which is really looking on the positive side. Again, some of the project information, when we look at proportion of infants, growth monitoring diagnosed with acute malnutrition between those years in the 3 countries, there's a decline. Also, acutely malnourished infants were received during the growth monitoring. We also see a decline because the services, information, nutritional counseling is really done through the different entry points. And so we're seeing some positive results in terms of these children or these infants during growth monitoring visits, which is also positive. Maybe now we can play a short video just to try and see from the field, what do we also see and what are providers, what are some of the women saying. So please, if we can start the video just to share some field experience.
My name is Mrs. Gamba Rochelle. I am a state midwife at the Urban Primary Healthcare Center. Here, in our healthcare center, we currently offer comprehensive care. The integrated services have a positive impact. The integrated services allow us to provide to the women the services that they request directly and those that they do not directly request but that could be beneficial to them. Each client that arrives is provided with care from the point of entry into our center. The services provided include healthy newborn and infant growth monitoring, vaccination, antenatal consultation, postnatal consultation, and delivery. When a woman comes for the healthy newborn and infant consultation growth monitoring, we start a group health education session. After that, we go back to vaccination information and services. We give advice to the mother and reassure her that the baby must be vaccinated. After the weighing, we come back again to our specific counseling where she will choose her contraceptive method of choice, which we will offer while advising her on the nutritional aspect with regard to the nutrition of her baby and the mother's diet, This is done to ensure good health for both the mother and her baby. All the services are offered at the same time. Here we are well organized because we work as a team. There is one who takes care of weighing the children, another takes care of the vaccination, another takes care of the well baby consultation growth monitoring, while another takes care of family planning. With the integrated services and the reorganization put in place, we manage to ensure a good client flow and are able to work in good conditions. The indicators are improving day by day. Our source of motivation is the satisfaction of our clients. For us women, leaving the house to go somewhere is not easy. But now, in only one day, we get various services such as child weighing, vaccination, family planning, and other counseling. Midwives are kind, which motivate us even more to go there for care in case of any health concerns. We save more time and it allows us to take care of our families. The midwife explained to us how to feed our children well and how us, being mothers, we must eat well so that children can get a lot of milk. She also talked about family planning. The midwife took me into a room where she taught me various family planning methods. I have the one that we put in the arm, the one that lasts for 5 years. I think that everything is good, but it would be preferable to take necessary measures so that we don't take long at the health center, for us coming very far away for care, because we have to go back and take care of our children and our husbands.
So thank you very much for having and being able to see a little bit of now something from the field, from the providers and also from the beneficiaries. So when we look at some of this, we're looking at what other opportunities are we seeing within the community of practice. Over the years, we've seen a growth in terms of the political will to work on trying to scale up this approach in the Francophone West African countries. So there's slow progress in terms of gradual progress, I would say, in terms of scaling it up. There's also opportunity we're trying to use with the West African Health Organization experience in promoting and scaling up best practices to the different forums to try and bring some of this information to share, within the country so that the ECOWAS also as a region could also look at this and even if possible beyond. Currently there's an online platform with a website indicated there where there's a number of resources, so programmers and providers and other could access just to see how are some of these experiences, what is working in the different parts, of the Francophone West African countries, and how can this be, if possible, adapted in the different contexts in the different countries. The community of practice itself, as we work with partners, we see this as a forum where we can try and work with more partners, try to advocate for this integration. Could this also be, as we talk about sustainability, could this integrated approach, its rated cost, be part of what is included in costed implementation plans for family planning? So it moves from being, for example, something vertical, a project, but part of a nationwide family planning program. The opportunities recently launching of the e-learning module on postpartum family planning. So where it's a challenge to do on-site training or classroom training. This could also be either for training, it could also be maybe for catch-up training or recycling training, as we call it. Also an opportunity through e-learning because of the technology that exists right now. Recently, another opportunity that has come up is the Bill and Melinda Gates Foundation is actually starting a pooled funding mechanism to see and support proposals that could be, funded to support country level scale up of this integrated approach. So all of these are possible opportunities to see what can be done going forward. Of course, throughout the process, there's been a challenge. When we look at, when we say the 9 OP countries, this is the Ouagadougou Partnership. These are the 9 Francophone West African countries. So it's about implementation progress, as we saw in one of the slides. It differs from country to country. Obviously, the health programs, health priorities are quite a lot. even within the reproductive health space. So sometimes it could be completing and competing priorities within a country, what could be supported, what could be, not supported. Also, while we could have costed implementation plans, but then there's also a gap on how can these funds be funded, looking not only external, also domestic funding, so that it could be as much as possible sustained going forward. And then there's not always availability. We look, to more and more partnerships to ensure, timely short-term funding, even sometimes technical assistance to achieve what is needed in terms of acceleration, this scaling up. And then also not always able to leverage from existing vertical programs to support the integrated approach. So there could be opportunities with different programs. How can they be merged, or how can they collaborate, harmonize, or complement each other to really come up with a bigger problem? And therefore, linked to this is resource mobilization continues to be a challenge to actually fill in some of the gaps that are required to support a country level scale up. So some of the things being proposed are how do we, support for development implementation of scale-up plans, even expanding, at the level of the country, even at the level of the regional committee of practices, more partnerships, more memberships, so that we could also learn and get input from other different partners. Advocacy for, partners to support. How are we able to align, jointly resource mobilize, conduct, round table of partners, so that really we discuss and learn together. The peer and e-learning, how do we use this as an opportunity in line with on-site mentoring, so that there's also on-site support, mentoring, supervision, strengthen experience sharing, so that we can foster the experiences, the successes in the integration, so that we can improve, as we saw in the beginning, the family planning and maternal and newborn and child health indicators that still need to really advance if we're even to meet our 2030 targets, which is just around the corner. Another aspect is how can we support countries to ensure that this integrated approach is included and implemented as part of really an existing national family planning and RMNCH program. Again, in the area of monitoring, evaluation, research, I think there's a lot that we may need to do to properly monitor, evaluate, is it in terms of the efficiency? Is it in terms of financing? How is this really working? Do we need to better document? There's work also, as you want to evaluate, do we need to strengthen the different indicators so that we really collect on an ongoing basis the work that is being done, successes, challenges, and what we learn from that. So there's a number of areas we could think about moving forward, and also would love to hear more from the participants. So I would like to end here for a discussion. Really to thank you for giving this opportunity to the community of practice to share this experience. So I would like to end here, and this is a photo of an annual meeting of the community of practice, bringing together the 9 countries. It was in August of this year, from government, from partners, really different stakeholders, to also discuss on progress and really agree on how more can we do, what more can we do, and how can we advance. So I thank you a lot for your attention. Thank you very much.
Thank you very much, Dr. Asman. This is a wonderful presentation. So Dr. Asman has shared the experience of 9 Francophone countries using this approach, which is added to the emerging literature, actually in Sub-Saharan Africa, showing that this approach can help to improve the delivery of reproductive health services, including family planning and the other. So the evidence that he has shared now is showing that the reproductive health indicators has improved, which is a sign of very good progress and a promising one. But he also shared that there's a very important issue to bear in mind, is that the collaboration is very important to assure complementarity that needs in order to advance this and scale up this approach. But also he shared some challenges and also suggest some way forward, which also including the need for monitoring and evaluating, as well as doing more research in terms of adding more information and also helping to shape the use of this approach, particularly in a different context. So we have some 20 or so minutes, and now we'll open the floor for comments and questions. I would like to ask the participant to say their name and go straight to the point so that we allow for more participants to comment. We can also use the question and answer text to pose our questions and the comments. And also we have the chat. So please, if you want to ask a question or comment, please raise your hand, and then we'll be given the floor to participate. I see another hand by Professor Akan. Please, Professor.
Thanks, Carlos. Thanks, Carlos. And again, thank you, Dr. Asmani. This is a brilliant presentation. Again, to thank you so much for all you do to improve child and maternal health in those 9 countries. I just want to, hear more about your insights, because one of those issues you've mentioned is how you are able to strengthen, particularly the health information system, also in those countries. So I want to hear a bit. So when you compare what you have in some of those 9 Francophone countries to what you have in the Anglophone countries, particularly in terms of the DHIS2, what are your views? My experience working in some of these ECOWAS countries, particularly Nigeria with DHIS2, is that despite the investments, there are issues around the quality. There are issues about the standard of reporting of some of those issues. I want to really hear your experience on how you are able to, either strengthen this, or how do you compare this to what obtained in other ECOWAS countries, particularly the Anglophone. The second one I want to learn about, because I was also part of a team that did some evaluation on this integrated model in some other countries. One of those major things that people also complain about is that some of those models do not strengthen the locals. That is, most of the programs are being consulted out to people outside their locality, which they found to be somehow unsustainable. They want to see that some of those people that are involved in the process of strengthening the systems are people from their own geographical location. So I want you to also share your experience in that regard with us. So finally, also to say that some of those outcomes of this integrated model, they are easy, at the facility level to measure the impact of some of those integrated activities. But when you come to population or community level, they are so difficult. So maybe you also put some insight into how you are able to do some of those things. Thank you so much.
Thank you, Professor Kani. We have in the chat a question by Dr. Rover from Madagascar. Does the program encounter any problem with traditional leaders or customers? And have any advocacy section been carried out with this category of people? Okay, so can you please answer this while other participants are thinking about other comments and questions? Dr. Asman, please.
Okay, thank you very much for the very good questions, and I'll try to respond. Very good. I think they're very good questions, and they're things that have also been in our thought of practice, and especially to seek how can we better go forward. So one of the things if I start with Professor Akani's question, it's very true. What we noted and what we're trying to improve, that's why we talk about expanding the working group, trying to improve sustainability and scale up, is there are a number of positive findings we're seeing based on specific interventions that were done to compare maybe an intervention site and a non-intervention site. So as you rightly said, we are also looking at the inputs when you look at the health information system strengthening that were probably provided where this intervention is going on at a number of levels in terms of trying to have systems for data quality improvement, data quality building, data checking to make it a bit better in terms of the quality of data, which may unfortunately not reflect the same out of the whole country. So how are those learnings could be used to look at what could be done in terms of looking at the overall strengthening of the national health information system in general to move away from where there's a success. I agree with you that it is not of the best quality across, the entire countries, for example, where some of these results came, but could have been as an impact of, maybe purposeful effort to address some of the exact challenges that you mentioned. I think whether I got the second part of your question correctly is really with what we mentioned about having the technical working group led by the ministries, also looking at sub-working groups at the district levels. These were also aimed at trying to see, are this implemented really in terms of the national context, country priorities, but also players, so that, as you indeed said, is it really something coming from external input? So to what extent are we having national expertise throughout this process? And what maybe was not very highly clearly mentioned, that over the years, this national capacity efforts were put to build so that the work that is done at the district level is at the district health team, the providers themselves, really through the system that is there locally, the support, supervision, mentorship. So gradually, this needs to be ideally, as you rightly said, strengthened so that at the end, we do leave this expertise there so that when we talk about scale up, etc., it does not necessarily have to be through this project program. And I think one of the areas we mentioned as looking at it from a way forward, when we talked about more, evidence and research, I agree with you, is to see what can we gather. We have a lot of evidence, we have in terms of how does it help in terms of improving quality of care, improving the options that are being given to mother and child, improving, reducing some of the missed opportunities for service provision. But I would agree that more could be done to look at out, the different impacts, because if we recall, the first slide showed a number of health indicators that need to be improved. Therefore, to what extent can we also do more? And I agree to look at maybe the higher level impact. So it's something I think as we work in partnerships, definitely something that could be welcomed within the community of practice to look at this more closely. From Dr. Rover, it's true even in this last meeting that I mentioned with the photo at the end, the 2023 meeting, one of the colleagues, one of the participants, so stakeholders included, were really community-based organizations that work at the community level, work with key stakeholders, religious leaders, traditional leaders, to see what is the role actually of community key informants, community gatekeepers, community influential people, which does include religious, cultural leaders, and other important gatekeepers of the community, to also support the process. Because as we talk about uptake of family planning services, especially including after the postpartum period, there could be some myths, misperceptions, different beliefs. So there was quite interesting input and engagement, and going forward to work more with these community level leaders or community level actors, so that these also could be addressed, the community components of what is being done. There was a question I saw on the chat around publications, whether these exist. And in fact, if there's an opportunity in later sessions, some of the studies that have been done, I hope have been published around this, could also be presented, because there are some aspects of studies, for example, around the cost efficiencies, because as we talk about integration, there are inputs to make this happen. So studies have been done. Is it also cost effective? The other studies that have been done, if I just look within the context of some of the work of the Committee of Practice, has also been on, does it increase maybe service provider workload? Is it manageable and things like this? So definitely there are some things that could be shared maybe in future webinars, but also for me, these are important questions for us players in the field to look at what more evidence can we look at to see how this is could be evidence-based approach. And as we work on advocating, as we work on scaling up, are we able to do and search for this success through, you know, available evidence or evidence that we produce? So I think those are the first round of questions. I don't know if from the chat box, the facilitators can let us know if there are additional questions and if I've well answered so far what has been asked.
Okay, thank you, Doctor. We will have given now, I heard that Fanico is now in position to ask the question, and we also have a question from Professor Oladumeji on if he wants to know if there are ethical issues that come up with the process of conceptualizing and or implementing this approach, and how if you address them. So Fadiko, do you want to ask your question? It seems that no, but the question is here, is he or she would like to know, to learn about health financing challenges, if there are, and integrating family planning into reproductive health. There is a question from Ahmed. Do you have data on contraceptive supplies for Comoros for 2019-2022?
Thank you, dear colleagues. I'll try to respond to the follow-up, additional questions. One, maybe just as an aspect that maybe I did not conclude in the past round, I could share with the organizers different research and research links, so that through this form we could share. I think there was a question if there's any research, even if some of these research papers or links could be shared. So I could look into that and share with the organizers around research around integration. There's a good question around health financing challenges. And actually, as of now, I don't have a lot of details, but one of the area or aspect that was studied around this integration in Francophone West African countries was actually the cost efficiencies and the health financing aspects. So I could also try and share also, if these findings are ready. It was done by the Institut de Recherche en Sciences de Santé of Burkina Faso. And so it had interesting findings in terms of what are the inputs, what are the additional financing, and it actually did find there's some additional costs, but the return on investment was good. So I think details could actually be shared around this. I'm not too sure about the ethical issues, if I have to, come back to that, but I understand that, the design was also through a consultative process to look at, what could be integrated where, what are the different aspects to take into consideration. But I believe these are also some things I could share, within this network, to get more information on any of these ethical issues, including from some colleagues from our Committee of Practice. Contraceptive information, particularly for Comoros, we do have, whether it's as UNFPA, also as partners from the different countries. So I could also be in a position, not to mention right now, but if there's a need to, within the forum, to also share what we have in terms of, the UNFPA information around different contraceptives, the commodities may be procured, if that is the type of question you want, and the stock levels, etc. That could be shared, thereafter, if this could be also helpful. So I think some of the questions might need me to come back to, but these are some of the elements that I have in terms of sharing.
Oh, thank you. One question I would like to raise is you're working in 9 countries. So from the experience of applying this approach, did you come up with some challenges or additional challenges that are linked with country specificity, or because these are Francophone countries, you didn't really have to deal with some challenges that you find more in other countries than in the others, or some characteristics that may facilitate in other countries and not in others that you would like to share with us?
Thank you. I think this is a very interesting question. So if you look at the background to the 9 Francophone West African countries, for some who might know, there's what we call the Ouagadougou Partnership, which really works on strengthening family planning progress in these 9 countries, because within the region, they unfortunately tend to be those that are within the West African countries quite behind. And in terms of being, more behind, it's also due to some of the contextual factors, religious, cultural, the political aspects and others that make it quite behind. So this is actually an initiative overall to try and speed it up, or at least to try and catch up in terms of the family planning progress in these countries. So there's something unique in terms of what they have as similarities, but also some of the particular challenges we see as we look at, for example, during the COVID pandemic, we know there was disruption of activities, disruption of service delivery, disruption of access. But within these 9 Francophone West African countries, if you look at the political, economic, and other scenarios right now, we also have a number of them are also countries, unfortunately, with a number of humanitarian related challenges. We've had, different political and the security disruption. So there's some uniqueness in terms of challenges to make progress because of the context. So sometimes in some places, people cannot access services are no longer available. There's not even safety to access services. So there's the humanitarian context, which is quite unique to some of these particular countries. There's also the other aspect that could become unique in terms of challenges is these are also some of the countries that might also have high teenage pregnancy rates, might also have high, other social cultural dynamics related, for example, to early marriages, etc. So these obviously impact on uptake of family planning, given the social cultural country context related to the delivery, utilization, and uptake of family planning services. These also become quite unique in terms of some of the challenges that we see in these countries. But again, some of these countries represent a number of government-led efforts that are really trying to increase uptake of family planning. You have a number of these countries that are looking at free family planning programs, actually delivering these services for free. So this becomes, I could say, an added value or support enabling environment for this. A number of countries within these 9 countries are looking at, for example, better and further integration of family planning in their work towards universal health coverage, their roadmaps, primary health care. So some actually as enabling, if I could say, not only barriers, but these are some of the uniqueness that we see with the specificity of these 9 countries in the West African region.
Thank you. We have some 4 minutes. Any burning question to close up? Dr. Estelle, do you have any burning question before we move to the closure?
Professor Carlos, no question from my side. Thanks.
Okay, thank you. Before I ask you to join me in appreciating Dr. Asmani, I would like to thank our sponsor, on behalf of the panel, the Johns Hopkins University and Bill and Melinda Gates Institute for Population and Reproductive Health. And also take this one to invite you to our next monthly seminar, which will be held at the very same time on November 29th. We are honored to have Professor Alex Eze, who will be talking to us about the divergent demographic experiences in the 21st century, implication for Africa and other low and middle income countries. So I would like to ask you to join me in appreciating Dr. Asmani, and later I will ask if the chair of the panel would like to say some few words in closing. Please, Dr. Khan, and then we will appreciate after your remarks.
No, oh, I thought you said we should unveil ourselves to thank the presenter. Well, let me sincerely thank
you
Dr.
can
Asmani.
say the word, and then we'll unveil.
Okay.
And we appreciate Dr. Asman. Thank you.
Okay. Dr. Asman, we really want to thank you for this very beautiful presentation. And I think a lot of people are really showing interest in what you've presented. I know they've sent their emails, but again, we are going to be sending the presentation to others. And I think for people who really want to, keep engaging you after this, I think you will oblige them to contact you and see what new things they can learn. So on behalf of a panel, UNFPA African Population Studies Panel on Family Planning, Sexual and Reproductive Health and Rights, we sincerely want to thank you and also to thank the UNFPA. Thanks so much.
Appreciate Dr. Asman for presentation.
So thank you so much, Dr. Asman. Thanks, Collins. Kelly, thank you.
Thank you very
Thank
much,
you.
everyone. Thank you.
Thank you, Steve.
Bye-bye.
Thanks.
Okay, bye-bye.
Thank you. Bye-bye. Cheers.